Sure. Well, as we're reassembling, I'm going to take the moderator's prerogative and ask a question to the panel to give some of them a chance to talk about some things that came up at the break. And I want to go back to a question that Pamela asked earlier in sort of orienting us all around the day, which is, are there some approaches that are easier to implement at different levels? I think many of you spoke about what's happening at the federal level in your departments, but also about ways that you're engaging with states and communities. And do you see different leverage points that we all should be thinking about as this work moves forward?
Yes.
Yes.
Yeah, I'm trying to decide which one to say.
Sometimes I think sometimes we're looking so high we miss some of the very simple things. For example, in the dining facilities, we kept thinking about how do we change the food we purchase and the menus that are made. But in truth, when I had breakfast in there, the soda machine was on. Well, why do you have to have a soda machine on for breakfast? Right? That's a lot of empty calories. It's a lot of, tooth decay. It's a lot of bad things. So my suggestion would just be that sometimes we don't always have to think really big. We can just look at the simple changes that can be made.
So there are different scales of government where it makes sense to make certain decisions. And at the federal level, we're thinking very, very big. But when you're trying to make a community, when you're trying to consider how the built environment's going to impact day-to-day living, that's a very localized decision. So that is the place where you're best going to see the land use decisions, the economic development decisions, and the transportation planning come together and work well. But there's a lot that can happen at the state level too. The public health people and the transportation people all answer to the same person, the governor, and the governor can force coordination there. Some governors have, other governors haven't, and there's an opportunity just to ask some questions of the transportation system that you wouldn't really realize is a lever unless you're inside the transportation industry. We have a big, thick book. It's called the Green Book, and it's all our design rules for roadways. And it has rules that they are theoretically flexible, but anyone who's worked with an engineer knows that flexibility is not a good word with them. They want strictures. They want to know what is safe. Because if they screw it up, someone dies. They're very serious about it, and that's a good thing. But the way our design guides is written encourages something that's very unhealthy for anyone who wants to move around outside of a car. So the health folks can start asking questions. What do our design guidelines look like? How do they make it easier for people to get around outside of a car? Do we have complete streets policies at this level? If we don't, why don't we? And you start asking the engineers and the governor that question, and it can start to pull together a really good conversation.
So we'll go ahead and rotate from the microphone, starting over here.
Hi, thank you for a great set of presentations, and I do have a question, but I would like to, Paula Lance from George Washington University. I'm going to start with a little confession. Jennifer, I too recently relocated here from the upper Midwest. I live in the district. I live in a really up-and-coming neighborhood and I don't have a car anymore. I walk everywhere. There's grocery stores. I live on 14th Street, almost to U Street. It's a part of town that's really coming alive. It's great. I feel guilty every day because I know of all the people that I and other folks who have moved into this neighborhood have displaced. On the way here this morning, I was picked up in a cab by an Ethiopian immigrant with his wife and daughter. In the taxi, they pick and say, "Where are you going?" I got to drop my wife and daughter off at school. They're both going to school to become medical technicians because that's where they think the jobs are. Told me he's probably going to have to move out of the neighborhood. He lives a little bit further north because the rents are becoming so high, the cost of food is becoming so high. So while some of us are enjoying revitalization in urban areas and it presents a great quality of life, what is happening to everyone else? And this is playing out across the country, so.
Yeah, and I couldn't agree with you more. I live on the other 14th Street in Capitol Hill Northeast, where the exact same things have happened in the neighborhood over time and throughout the district. And Yeah, I mean, I think that's one of the reasons why we're doing things like the affirmatively furthering fair housing work to really have communities take a look at what the geographic and segregation de facto results of policy are in the way that we do this work, and to actually have it be a data-driven analysis so that you have to kind of confront these facts. People have to want to do the right thing, and it strikes me that in the absence of wanting to do the right thing, a lot of really bad things happen. And I think that it's just something that we need to be able to kind of speak factually about. But I'm with you. It's every day when I walk home through Lincoln Park, I mean, I am painfully aware of that same thing.
I've gone through this recently. I have a wonderful woman who helps take care of my son who wants to live close to where I live, and I tried to help her find an apartment for her and her kids that basically cost less than my mortgage, and it was impossible. Could not be done. And one of the things that's very interesting is the reason for this is there is an incredible demand for these sorts of neighborhoods. It's more than 50% of the housing market. The supply is someplace around 5%. There's no policy way to fix something that is so drastically out of whack. We need more neighborhoods to be like this. Until more neighborhoods are like this, we're going to really be behind the ball. So we've got to retrofit a lot of communities quickly so that there's not such insane pressure on the tiny amount that exists now. And my program policies have to support that.
Thank you.
Over here.
Yes. Good morning. I'm Phyllis Meadows, one of the roundtable members with the Kresge Foundation and University of Michigan School of Public Health. And my question is a little bit similar to Paula's question that she just asked. I think it really sort of captures the same sort of sentiment. And that is, if you're successful, but first I want to thank you for the presentation. It was very insightful and encouraging. But as you think about the work that you're doing, if you're successful, there will be a displacement. I mean, there will be a furthering of inequities, excuse me. And so what I was curious about, since you answered part of the question, my question with Paula's question, is what are you doing in your organizationally in the conversations that you're having and the processes that you're engaged in to address inequities? Is that on your plate? Is that in your mind? And then what processes are you using to, one, hear the voices of the people who are going to be impacted by some of the changes that you make? And then what processes are you using to assure that the good things you're doing don't further the inequities that we see in these communities?
I'll answer that question partially. And one of the things that I talked about was the use of health impact assessment as a process to look at a pending plan or policy. And one of the core values of HIA, as stated by the WHO, is equity. So that's a very core part of looking at any policy. So if you have a neighborhood development that's going in where you would anticipate that there would be displacement of lower income, that would all become part of the assessment, the health impact assessment of that plan or policy, and make recommendations to try to mitigate that. And I also believe that if there's the opportunity to look at it from fully, with a broader, bigger lens, and think about all the cascading impacts of displacing those people and the additional cost incurred by doing that, then you're going to relook at your plan and think about, well, how can we accommodate everyone and make it a better place and tap down some of that displacement. So I think that there's an opportunity with a process like health impact assessment to look at the equity issues and to offer some other alternative solutions to a local plan or policy. So that's just specifically communities making decisions about those types of developments. So.
And I'll add that, you know, we've just updated our New Starts guidance and in collaboration with HUD have really tried to put the affordable housing element into the process to evaluate projects to make sure that consideration is there. We want to make sure that the people who are transit dependent are able to access the transit project that's going in. But I would also say if we could reach a day where, you know, right now 55% of, you know, according to a lot of market surveys I've seen, want transit-served walkable communities. If we had 55% of communities that were transit and walkable, you wouldn't see that massive, you know, rush to get into that neighborhood that we see right now, and that would really help. We're trying to expand people's access. The Secretary and the President talk about it as access to opportunity, ladders of opportunity. And so just trying to make sure it's in more places. Where it is, we want to make sure that there's consideration that those who need it have access to it, but there just needs to be more of it, because right now if you've got 10,000 people trying to get into 10 homes, you've got a problem for the people who have the least resources.
I'll just add a word if I could. I mean, I do think that we have a vision of a healthy and sustainable community as one that is both racially and economically diverse. And you know, how we translate that to the ground is the work that we have to do in community and with communities. But if you don't start with that vision, and I suspect that there have been other secretaries of HUD who have not started with that vision, you know, then you're absolutely not going to get the job done because you are trying to do something else. And so, I mean, I guess what I can say is I don't know that we've got the magic formula for translating it into community, but we absolutely have a commitment to that as the vision and the place that we need to go, which means that who sits around the table is different than who would sit around the table if that weren't a fundamental part of what we're trying to accomplish.
I think Jennifer's key word was with communities. We have to find ways, as was pointed out to us this morning, to help people self-activate and let people know that their voices are important. And if we can motivate people and activate people to help influence and shape their communities and give them that voice at that level, then we can both at the federal level be sensitive to that and have our policies be sensitive to that, but empower that grassroots level too to shape their future.
Just very briefly to add to that, I'll say that I think a question that we get a lot at HHS is about what is the what's the National Prevention Council and what are all the departments that make up the council doing about health disparities, and eliminating health disparities is one of the 4 strategic directions of the National Prevention Strategy. But I think one of the things we always point out to folks is that, in fact, all of the strategic directions, including promoting healthy and safe community environments and promoting empowered people and increasing linkages between clinical and community preventive services, that all of those have a component that's related to equity, and that we're not just operating within this health disparity space, but that all of the, you know, things we've been hearing about today also are contributing. Over here.
Good morning. My name is Martha Gold. I'm from City College, and I really want to join everybody in thanking this panel for a really wonderful discussion. I was part of an IOM committee that looked at health and all policies, and we talked a lot about the Prevention Council and the possibilities there, so it's kind of exciting to actually hear what comes out of that. I wanted to go to Florence Folk to ask a question, because one of the things that came up a lot in our committee meeting was a discussion of health impact assessments. And I wanted to sort of be practical in thinking about what it costs to do that sort of thing. There were a lot of people who felt that if health impact assessments became the sort of the state of play, everybody would be spending an awful lot of time, you know, doing the analytic work, and it wasn't either an inexpensive or a fast process. So I wonder if you could talk about the Green Street HIA and kind of what that sort of, who was involved, what that entailed, how long it took, what kind of resources.
Well, can I talk about a couple? Do I have
Absolutely.
to just talk about the Green Street? The Green Street project is really one of 2 HIAs that EPA is undertaking. So just by the sheer fact that EPA is involved, it's going to be a little more involved and have more resources than what you would typically see. So there was some funding associated with it. The majority of the funding has gone towards bringing the people together, the community meetings, the stakeholder meetings, and also developing the document. and doing a lot of the lit review that supports it. In contrast to that, I am also a member of the Health Impact Assessment Work Group for the Cincinnati Health Department. And we did a rapid health impact assessment on a prolonged heat policy for the city of Cincinnati that took us about 3 weeks. So I think the key is there are different levels of rigor for a health impact assessment. One of the goals that I have in the work that I'm doing with EPA is to kind of level the playing field for all communities and provide freely accessible web-based tools that can give them the literature that they need to understand the relationships between the built natural environment and public health, and to provide tools and models that don't require lots and lots of data to be able to run the models. So to try and increase the rigor through making more things accessible. So I'm sure Erin could probably give you a better idea about the cost. But in the health impact assessments that we did in the review, there were some that were funded by external organizations and others that were just completed strictly by the staff that they had on hand. So it doesn't have to be an onerous, costly process if we can get the support and the tools available for communities to do that. One of the things that I always say, and I'm going to say it here, communities are making decisions every day. They're making those decisions every day, whether we are at the table or not. And so any way that we can come to the table and help them with those decisions, we're going to be one up. So, well said.
Yes.
George Isham, Chair of the Round Table. I was particularly intrigued by the map that you showed, Captain Elenberg, about the bases and the distribution, and your comments about the fact that the communities in which your bases are located affect the health and the readiness of the military personnel that serve on those bases. And so, and I really applaud the interest, that you have in that, in improving, looking at population health and improving, the health of military service folks, as well as this extension apparently into the communities. So my question is, do the base commanders have a scorecard of the status of health in those communities? And are they, do they have the kind of assistance they might need to think about what factors they ought to be thinking about in their relationship with those communities? And then secondly, I'm just listening to the whole spectrum of presentations on the panel. To what extent could you, are you drawing upon the different departments to characterize that, those communities in terms of all these factors that this very talented panel has raised that affect health? And then the last comment I'd make is that this is the 40th anniversary of my service in the Navy for 3 years, and I served at 2 bases, one of which is closed and one of which is still active. And so I wonder, in terms of policy formulation, whether the health in the communities and the efforts of the communities to improve their health may become at some point a factor in terms of base location and readiness of our military. I don't know if that's a good idea or not, but I'm just, and it just occurred to me off the top of my head, and I can think of both negative consequences for that as well as positive, but it just occurred to me as a thought in terms of drawing attention to the fact that place does make a difference. So thank you very much.
You're welcome. We didn't, one of the things that was intentional was we did not ask the military health system to select the bases. Military Community and Family Policy reached out to the line, meaning the services and the base commanders, to select the bases for consideration. And that was great because it built a partnership. And what they ended up selecting were many bases that had forward-leaning commanders that knew the importance of health already. So this helped us. You know, we were looking for people to work with, not somebody that wasn't really interested yet. So it gave us an advantage there. These commanders are very hungry for a scorecard. Right now, you know, if you go, sir, to the physician or a clinical provider, and ma'am, you go, and you're going perhaps for your womanly checkup, and sir, you're going because your ears hurt you, you're still going to get the same basic thing done when you come in. You're going to be triaged with basic vital signs to give you an assessment of your health in general. And then they'll look at your acute reason, you know, what's that acute episodic reason you're there, and address that, right? Our installations do not have a scorecard yet like that, like those base vital signs of what is a healthy installation and are we achieving that. What happens right now is we get distracted, you know, by acute episodic events. It's kind of like the movie Up, you know, where the dog is running around and then squirrel, you know. So that happens for us, you know, whether it's, and they're very serious things, you know, whether it's suicides or, you know, sexual assault or things like that. They are things that absolutely need to be paid attention to, but they are crying out for a direction. What does a healthy base look like? What is that scorecard? How do we get those metrics and have that as a steady state? And that will allow us to continue to meet our mission and address acute episodic things. And so that's one of the things we're going to try to achieve with defining this year, work with them to help support them in that request, as well as, you know, again, that Health Promotion Council, if we have members of the programs across the community collecting those metrics, those things that influence health, whether they're directly related to the health system or not, right, they can help contribute to that scorecard so that the commanding officer will have a dashboard, very simple, and know how are the people of his community doing. As far as drawing on the different agencies, I'm not sure if I've had an original idea in my life. I very much count on reaching out to subject matter experts across the different agencies, and I think one of the unique advantages to being a U.S. Public Health Service officer is that, you know, we have officers that sit within all of the different federal agencies, and so I have rich resources and relationships to draw upon already. So that I take advantage of that for certain. And as far as efforts of a community, the community being a factor in base location, it is now for certain reasons, but health and the health of the community or what that could support has not necessarily been a historical consideration, and I'm not sure really if that will be a future one, but it's an interesting thought to perseverate on.
Over here.
Hi, I'm Maris Ash, and I'm CEO of Change Lab Solutions. We're a nonprofit organization working nationally, funded by Robert Wood Johnson Foundation and the Centers for Disease Control to work on the very issues we've been talking about. And I just want to put the question about gentrification in the same paragraph as the questions that Dr. Williams was raising earlier around concentrated poverty, and both are problematic. And I think the challenge for us is how do we find the right balance, because just leaving concentrated poverty, we just saw all that health impact, a tremendous health impact, and so that's not an end state, the status quo. I want to talk about some practical strategies to address this, and these strategies are being used at the local level, state and local level, and my question to the panel would be, how do we get the incentives from the federal level flowing down so that we can amplify and accelerate this work at the local level and maybe even require it? So inclusionary zoning, when you're doing your land use planning, that you require mixed income and mixed housing types in the plans. You may not simply only zone for single unit homes, but mixed income homes. We have infill guidelines coming out of our state Office of Planning and Research that require mixed income when doing infill redevelopment, and that's happening in Washington all over the country. And I think we're looking at what's happening in Washington, what's happened in San Francisco, what is happening in New York City too, of bellwethers of that if we don't take some of these strategies, that we will be the modern-day urban renewal, Negro removal, where they just came in and bulldozed whole neighborhoods to get rid of concentrated poverty. We could do the same thing with just such good feelings like complete streets and such good health outcomes from this if we aren't paying very, very close attention to this. Rent control and rent stabilization. We've had that. We've had prospective rental housing agreements. They've been preempted at the state level, so communities that are trying to protect themselves from this kind of problem are having pushback. We need incentives for developers to do the right thing. What's happening in California, we're going through CEQA reform right now. We are saying that you can put in less parking if you put in more mixed income housing, really putting it right into the environmental review to build in the equity component to incentivize the right behavior. We need transportation plans that have metrics in them, and I don't know enough about your green book, but I know how transportation planning happens in the San Francisco Bay Area in California, which is the metrics are used to move people of highest income into their jobs. It's income-based metrics, and so people who have higher incomes get more access to transportation, and when cuts are made, it's all based on family economics or regional neighborhood economics. We should be flipping that, so we've got transportation, the metrics going to where there's the least income and to prioritize the equity motion there. I would draw attention to the fact that the Urban Land Institute is making healthy communities their 2-year commitment for the next 2 years. That's the biggest developers in the country are taking this on head on as a group. That I wish I had thought about that before today, because it would be great if they were here, and we'll get I'm glad this is being taped so they can listen to it, that we have to be looking at our financial incentives for the Community Reinvestment Act to require all of these sorts of strategies when they invest in communities, so we don't just do the modern day version of what we so abhor from the 50s and 60s. Thank you.
Yeah, yes. I was just struck by the fact that with these $70 million appropriations and these planning grants that we were able to do in our sustainable communities work, that does create incentives that can significantly change behaviors, that can significantly change community outcomes, and it's not a lot of money. I think that the fundamental thing that needs to happen is that we need a new Congress that knows how to do their job, and we need to kind of have some serious conversations about the budget instead of having the ridiculous conversations that are taking place right now. Because the ability to have the types of money that creates these competitions requires a partnership between Congress and the agencies that do the work. And we're trying to figure out everything that we can possibly do with the monies that we have to line them up and make it work and go do it. But there's no sweeter incentive. New money accomplishes bigger change than old money ever can. And so I just think it's, I'm going to stop right there. I have nothing nice to say after that.
I think you make some amazing points, and it's interesting, some of the proposals you have are things that most people in DC have never even heard of. Parking requirements, how many members of Congress do you think are familiar with basic parking requirements at the local level? Probably some who served at the local level, former mayors, things like that. In inclusionary zoning we hear more about, but in the history of my program, it was considered like dropping a curse word to use the term land use in my bill. So there's a belief that the federal government has no role there, and how dare we approach that. So a lot of it, I think, is making the connection. Not saying that we should make land use decisions, because we could never do that. We could never do it well. But how can we make sure that the locals have the tools to make the right land use decisions? And that's the planning grants program. Tiny bit of money is completely transforming communities, because it's giving people the support they need to update their data. Right now, people are dealing with household transportation data that's 15 years old. How many communities look the same as they did in the 90s? To update their models so that they can figure out how people are moving around and what they're doing. To take a look at their zoning rules and update all of the master plan in the area. all that takes money and resources. And what happens when you're cutting back the budget is the very first things that go, planning funds. So it turns into ready, shoot, aim, or maybe never aim, as opposed to really thinking about where this money is going and what you're going to get out of it. So that's a big thing. We're also really working on tools. So with our limited ability to impact where this money is going, because most of it we're passed through on a lot of the money, can we supply folks with ready-made tools that they can utilize to help figure out how these things go together? Because it sounds like it's clear, but it's a whole lot of different things you're trying and competing interests you're trying to put together. So I think the Housing Plus Transportation Affordability tool will be very, very useful to people. And looking at other tools like that, there's some great work in some of the nonprofit sector, and EPA has done some amazing work in just looking at what developable land exists close to transit facilities, just so you know where your opportunities are. And so we need to go further there. And I also challenge folks in the audience, where you run into barriers, raising them with us. Sometimes we don't see how our program connects with a barrier. Elevating it to us and seeing if we have the authority to get rid of it. HUD did, I'm going to brag on HUD for a minute, when Secretary Donovan came in, they found an old administrative rule that said you could not build multifamily housing on a former brownfield. Because there was but the rule came from the early 70s when we didn't know how to clean up a brownfield properly. And you didn't want to put poor people on a brownfield. That's not the right thing to do. But now we do know how to clean up a brownfield, and the rule hadn't changed. Most brownfields are in center cities where there's transit. So there was a mismatch there, and they looked for an opportunity to update that. We're trying to find those, and the extent to which you all can help us, the better. And then I just wanted to also talk about performance metrics, because you're right. The right performance metrics are amazing, and the wrong performance metrics are really damaging. We need input. It's really easy to tell me why that performance metric is the wrong one. What I find is when people then come forward with their own idea, someone else tells you why that's the wrong one. Mm-hmm. So there needs to be some serious dedication to what are the right measures. And frankly, people have not done a very good job of developing the measures that capture what you're talking about from any sector. So let's use that as a charge and figure out what those are, and then share them with communities so that they have a sense of where to aim.
Sandy Magnan from the Roundtable, and I'm on the communication subgroup and the catalyzing a social movement subgroup. So you'll understand where my question's coming from. Captain Elenberg, I particularly liked the subtitle at the bottom of every slide that said, your health is our best defense, in that it could appeal to people no matter what their political persuasion was, both sides of the aisle, and that message could resonate. So I wondered, from all of your perspectives, what messaging, what language are you using that can appeal to both sides of the aisle to help us find some common ground, such as your health is our best defense?
I mentioned it in my speech. You know, a lot of folks love the concept of livability because it's good for the environment, it's good for public health, it's good for access to opportunity. But the issues that resonate the most is it saves people money, it saves the government money, and it gives the people what they want. And so I spend a lot more time focusing on that because that meets particularly federal policymakers where they are. And I also have to say, you know, the bike community is very, very active, and they spend a lot of time talking to us about what they like to see. But I've never heard someone say, I ride my bike and I hate riding my bike, but it's good for the environment, so I do it every day. It turns out what people say is, I love riding my bike, I get exercise, I feel good, I'm focused when I get to work, and by the way, it's good for the environment. And so we do have to think about really meeting people where they are, and not necessarily what they say, but really what moves them. And that's probably another collaborative we should focus on together.
And it brings me to the work that we've been doing on homelessness, and a lot of that has been about message reorientation because the moral outrage argument wasn't making any headway. And so the idea that we can actually begin to demonstrate to communities that by doing nothing, they're spending the money anyways. I think that that still has not been as resonant as we would like to be. We've made a lot of progress, over the last 5 years on reducing veterans' homelessness. And I think the idea that somebody who has gone to another country to fight a war to protect the homeland shouldn't come home and be homeless. I think there's some resonance there. I think that there's been traction on both sides of the aisle, the ability to fund many more housing vouchers in partnership with the VA to get veterans off the street. I think we've seen a 25% reduction in veterans homelessness in this country over the course of the last 5 years. So I think that there are places, but a lot of it, I was in this fight in Minnesota all the time, that there were a lot of people who believed that moral outrage was the reason why people should do the right thing, and there was something that was kind of dirty about talking about the ROI and the cost-benefit analysis. And but I think there has been something that's been effective about talking about the ROA and cost-benefit analysis. And so, I'll sell my soul for that.
One of the challenges that we have seen in the Office of Research and Development is helping people understand the services that ecosystems provide to people. And so that's one of the areas that we really are working on our messaging, is the link between ecosystem services and human health, and how protecting those services are also enhancing human health and public health. So that's an area that we're working on in messaging.
I would encourage anybody who's doing anything that has to do with public health, if we want to influence folks, it is sometimes being able to wrap things up in a nutshell. And I want to thank my CDC colleagues who really have gone out of their way to help us with thinking about strategic communication. And I want to recognize Karen Roberts and her StratCom team. We actually developed the strategic communication component of this before we developed anything else. Because we knew that we would need the movement of the people, right? Because in the morning when you wake up, what do? You probably go to the bathroom and brush your teeth, right? You make the choice to brush your teeth because it's something that you know you need to do. And certain things, if you can get them in a nutshell and you can get them out there, they will have influence, right? So anyway, our StratCom was really honestly developed ahead of time, and it's because I learned through my work with CDC that without a good strategic communication campaign, you're not necessarily going to be very successful.
Dave Kindig, University of Wisconsin, and a co-chair. A comment and a question. The comment is on your opening thing about what levels do the multiple sectors operate at? For 10 years, as you know, I've done a few models in my life, but I've not been smart enough to sort of do this model that sort of shows how the different sectors operate at the different levels, both public and private. And so I challenge some bright young person with a GIS and epidemiology background to do that for us. That's the comment. Because I think it would be helpful in moving this understanding. So the question has to do with the ROI issue. And I've come to think of multi-sectoral work as I've learned a lot actually from Elizabeth Rigby, my colleague, that you're kind of thinking about the win-win or the co-benefit possibilities, because other sectors have their own stuff to do, much of which may not contribute to health, but some of it does. But when both Andys, Andy Ryan and Andy Weber, asked David Williams the question this morning about what do we know either about the relative effectiveness, but they ask a question about the relative cost effectiveness of the competing marginal interventions across sectors. David Williams said, I don't think there's much going on, and I'm afraid he might be right about that. But so my question is, A, do the people in the agencies or others in the room know about even beginning ways that we might be able to think about those relative investments, so we can compare them to each other, and also so we can compare them to the medical care investments that we believe are not appropriate. So many of them are ineffective. And if there isn't anything going on, what can our community do to stimulate that kind of work?
There's a budget guidelines in the Deficit Reduction Act that says in the federal budget, a discretionary program that creates a cost offset in a mandatory program cannot book the savings of the mandatory program as justification for making the investment in the discretionary program. No, I don't. So let me say that in English. So housing is not an entitlement. And if housing does in fact have a health impact, and if with Medicaid expansion it has a significant federal dollar impact, it is not possible to work with the Office of Management and Budget or the Congressional Budget Office to justify an increased investment in housing based on a cost offset in Medicaid. So it's, you know, I mean, it's just, that's stupid, right? So, I mean, but these are the rules, you know, with which we operate. And yet the good thing is that in a state budget, you can actually bring those types of conversations into play. And so we're seeing places like New York and Ohio that are betting the house on the fact that an upfront housing investment is going to yield Medicaid savings, and even though they can't take our part of the Medicaid savings to pay for the housing investment, they're taking their own part of the Medicaid savings, you know, and doing that. And so, you know, I think it's about figuring out where the money is fungible and figuring out, you know, what makes the most sense in those regards. But back to the beyond dispute, you know, point earlier. I mean, I think we also just need, you know, more and better research to back these things up, because some people seem to be a little thick-headed to what seems the common sense of these arguments.
I would also point out that we cannot just look at return on investment. We need to have economic models that can look at costs avoided, because costs avoided are just as valuable as a return on investment.
Yeah, and I mentioned an example of that earlier with Salt Lake City that looked at avoided infrastructure costs by just moving people where infrastructure was underutilized, which has lost a lot of time on return on investment. One thing we've been trying to do, which is it's way more narrowly focused than what you're asking, but it's still an important step, is in our Tiger program, we require our applicants to do a full benefit cost analysis on the project. And the benefit cost analysis we encourage to cover a lot of things outside the transportation world. The five subject matter criteria that we're looking at is whether or not the project improves safety, economic competitiveness, livability, sustainability, and state of repair. And so we look at any number of things in there that people can quantify, and we actually encourage people to talk about the things that they struggle to quantify and look at overall benefits that often go well beyond the transportation sector and overall costs that often go well beyond the transportation sector and compare the two. And it's been terrifying for a lot of our applicants. But our goal is to encourage them to go through that thought process as they determine what sort of project they should be pushing forward. And so it's a little more on the micro scale, but I think it's still important overall.
But to that end, that's a request that I've heard across the country and across the world when I go to these installations. They're small communities in and of themselves, and they say, how do we do that? They need training. They need to be taught, how do we look cross-sectorally? What's the difference between an output and an outcome so they can start getting to that effect?
And we've been doing some training within transportation, but there's so much more is needed. And one of my little dreams is, can we create an online tool that people, because frankly, a lot of it is just knowing the series of questions to ask yourself. And once you ask yourself the question, you do know where your data are. You just didn't realize that that was the data that was needed to go into this formulary. So that might be one of these tools we should be working on together.
There we go. Do we have time for one last question, George?
I will ask a question of just one panelist that can be answered yes, no, or maybe. I'm Ned Codd with the Massachusetts Department of Transportation. I'd like to ask Beth Osborne. I'm glad that you asked for input on your performance measures because you know, I actually have a presentation a little bit later where we'll talk about what we're doing for healthy transportation in Massachusetts. But you've spoken a bit this morning about the high demand for livable, walkable communities, communities where there is transportation choice. And when there is transportation choice, a lot of people do choose healthy transportation. And this undersupply and demand is, by the way, something that really drives gentrification. Is there, and we are eagerly awaiting the federal MAP 21 performance measures to come from U.S.DOT. Is there potential for considering a measure such as transportation choice within those measures?
The answer is yes. It won't be mandated from us. Congress actually prohibits us from coming up with any measure not specifically listed in MAP 21. But it doesn't limit you. And one thing I would love to do, to brag on Massachusetts for a minute, Massachusetts has a system of government that really encourages the type of collaboration between housing and transportation because they have super secretaries that look over both. And it's an incredible model that folks can learn from. As you all are developing some of these performance measures locally, that we should bring it into the conversation and look at whether or not it's something that should be considered nationwide. I know you all look at this. Baltimore has an accessibility one where they look at how close people live to transit. I think it's within a half a mile of transit, things like that. So let's definitely talk about it going forward. I think Congress, when they consider reauthorization, they're going to look at adding one or two performance measures. Maybe this is the one that should be added.
But is it something that could be considered under, say, the reliability category of measures?
Well, that's a very interesting proposal. We should talk about it.
Okay.
Maybe.
Thank you.
Maybe.
Thanks very much to all of our panelists.